Yes, once again, we've got Commerce Secretary Gary Locke, and we welcome also Health and Human Services Secretary Kathleen Sebelius. We welcome you both. Thank you for joining us today.
Thank you. Nice to have us.
Secretary Sebelius, how extensive are we expecting this season to be, and what role will swine flu play in that?
Well, we don't know. What we know is seasonal flu kills about 40,000 people a year, has 200,000 people hospitalized and millions of cases. We anticipate this flu season will be worse because we'll have a mixture of H1N1 with seasonal flu. So a couple of steps that we'd like employers to begin to think about. One is get your seasonal flu shot right away. It's available right now. The vaccine is ready to go. So we'd like healthcare workers and elderly Americans, younger Americans, folks who get their flu shot,
is that different from the swine flu shot that would be available?
It is.
Yeah, okay.
It is. We didn't identify this particular flu virus until mid-April, and seasonal flu vaccine was already in production. If we had identified it earlier, it would be all combined.
Should people get both
this year
when it's available?
Yes.
Okay.
They should get both, and there's a different priority group. What we know is H1N1 is a young person's flu, so pregnant women, younger Americans, 6 months to 24 years, older, 24 and up, with underlying health conditions, and certainly healthcare workers need to be at the front of the line for H1N1. But it's going to have a big impact on business, and that's really what today was about.
Secretary Locke, if I could turn you to that point, this flu comes at a time which may be very taxing to a lot of businesses that are already under a lot of pressure financially. What is your best advice to employers if indeed we do get a large outbreak of either the seasonal flu or the swine flu?
A couple of key points. Number one, they need to plan for potential absences and possibly large absences of their employees. So that really means cross-training so that if a lot of people are sick, there are other people in the organization, in the business who can continue on. So they need to focus on continuity of operations. Number two, they need to send a very strong and loud message that if any of their employees come down sick, that they go home immediately and not try to grin and bear it, not try to come to work sick, but go home and stay home.
A lot of employees are hesitant to do that, especially in an environment right now where, you know, they're under financial pressure and they're worried about losing their jobs, they're worried about layoffs. Do you think that that's realistic?
Well, that's why I think employers need to be very flexible in their personnel policies, especially with respect to hourly workers, because if they were to terminate their employees for going home sick, it's actually perhaps going to be even more burdensome on the company to find replacements to train them, and the people that they may be bringing on may also become sick or may actually be sick already. So it's really incumbent upon companies to be more tolerant. For instance, don't demand, for instance, documentation that if people are sick that they have to have a note from the doctor, because that's going to crowd the doctor's offices and healthcare clinics when they're already going to be taxed trying to treat the sick.
Speaking of healthcare, I'm sorry to take a right turn here, Michelle, Secretary Sebelius, but as you know, there's been a lot of discussion about the healthcare industry and the healthcare plans that are on the table within Congress. Our viewers are so interested in it because it's such an important part of the way they do business. The public option, is that optional or is it not?
Well, the president continues to believe, and I share his belief, that cost control and competition go hand in hand. So having a new marketplace with some competition for private insurers who often have a monopoly in the marketplace to hold down costs and, as he likes to say, keep the private insurers honest, as well as giving consumers some choice. Probably the best way to do that is a public option. He has said that repeatedly. I continue to say that repeatedly. Are there other ideas? Yeah, there's some discussions out there, but the public option is a definite way to make sure that consumers in a new marketplace who don't have affordable coverage right now have choices and have some competition for the private industry.
There was, as you well know, some confusion about what you and the president said over the weekend, whether or not it was off the table. And the question I have is, if it's not the public option, in your view, I mean, people were wondering if the president's not pushing for public option, then what will provide the kind of competition for the health insurers that are out there right now if it's not going to be the federal government?
Well, I have to tell you, I think maybe the weekend was just a slow news day because I said basically what I've been saying for months, which is that we need cost control for every American, or a lot of people who have coverage today won't have it next week or next month. And we need choices for consumers, which is why in a state like Kansas, my home state, we set up a public option side by side with private insurers for our state employees, because one insurance company dominates the market in most of our state.
But as you well know, it is being resisted by the Republicans and some opponents in Congress
and moderate
right now.
Democrats.
Mm-hmm.
And so the question was, if it's not going to be the public option, is there an alternative to that, in your view, that would provide the similar kind of competition?
Well, we don't know. The Senate Finance Committee is the final of the 5 committees to come up with a draft. The other 4 bills have a public option as part of their draft component. Certainly Senator Conrad and others have talked about some kind of co-op structure to provide the kind of competition.
Would that work for you?
There is no language. Well, it's hard to tell. You tell me what the language says, and I'll tell you if it can provide for cost control and competition and choice for consumers. But I think those are the essential elements to make sure that, you know, if you have a monopoly and just trust the insurers to hold the prices down, that's probably not a good bet to make on the future.
Before we let you go, isn't that part of the problem right now? There is no legislation that we can all get our arms around and debate. It's all still very fuzzy at this point as it goes through the various committees in the Senate and the House right now. Yet people are rushing to judgment one way or the other as to the merits of health care reform in this country. Should we be patient? Should we be, or should we just start over? As Adam Boyd, the congressman from Florida, said the other day, maybe we just start this whole thing over again. I mean, how should we proceed from here, Secretary Sebelius?
Well, 4 of the 5 committees have bill drafts, so those are available, easy to read. In the House bills, there's a minor variation, but basically there's a lot of common ground. The Senate Help Committee bill has probably 80% of it mirrors what the House bills have. We are waiting for the final committee, the Senate Finance Committee, to come up with their draft. But I don't think there's any question. It's very good news that lots of members of Congress, Republicans and Democrats, have rolled up their sleeves to tackle this complicated issue. And there's general agreement on one very important thing. The status quo doesn't work.
Secretary
Sebelius? The status quo is unacceptable.
We all buy our own car insurance. We all buy our own life insurance. We'd get competition if we all bought our own health insurance, if it was completely disengaged from the employer and the government. Wouldn't that bring a lot more supply to the market and actually lower prices and make health care more affordable?
Well, it will lower prices if you are young and healthy. No question about it. And if you can guarantee you'll stay that way, you're perfect in the individual market. If you're not, what you really have is not insurance, but you're paying your own health costs. You may as well pay it out of pocket. Insurance is about balancing risk. Mm-hmm. So you want some healthy people and some folks who aren't so healthy to share the cost, to share the opportunity. And frankly, the individual market right now, where you're in there on your own, if you're 26 and healthy, perfect. If you're 50 and a heart attack survivor or have a pre-cancer condition or have high blood pressure, you are really in bad shape. Your costs can be skyrocketed. You can be dumped out of the marketplace at any point. And that's part of what health reform will do, is change those rules for insurance companies. They can't pick and choose any longer who gets coverage and who doesn't.
Secretary Locke, if I could bring you back into the conversation as it pertains to the swine flu.
You can ask him the tough question.
Well, feel free. You know, I noticed he wasn't weighing in there, Secretary Locke. I mean, come on, don't hang her out there. Come on, weigh in on this.
You accepted the job.
That's right.
We were governors together.
Yes,
you know, we can do this together.
We know, exactly. But if I could turn you back to the swine flu and influenza, and as it pertains to this discussion about insurance and the burden on employers, the burden on employees, what kind of response have you gotten from businesses? I assume that you have talked to businesses about the same thing you're talking to us about being more accommodative to employees, about not being punitive when they decide when employees decide to call out sick. What kind of a gauge are you getting from employers as to how cooperative they are going to be?
Well, a lot of employers are very concerned about it because these are tough economic times and they want to make sure that they have the workforce to sustain their operations and to rebound. That's why it's so important that they start planning now for the flu season and cross-train their employees, but also come up with flexible personnel policies, making sure that people go home immediately, stay home, that they not, for instance, demand verification that they were sick, because that will just tax the healthcare system. And second of all, really emphasize cleanliness and personal hygiene. Constantly washing people's hands.
Yep, we got those Purell containers all over our studios.
And in fact, here's a toolkit that every business can use, and it's available on the internet at www.flu.gov. Flu.gov. Incredible tips on how businesses can cope with this and actually continue to operate.
We know that there are other people waiting to talk to you. So.
Secretary Locke, and I still can't get used to saying Secretary Sebelius. Governor Sebelius, thank you both for joining us today. Appreciate it very much.
Nice
Thank you.
Talk.